Hi guys, today I want to show you a couple of really quick and easy ways that you can sort out wisdom tooth pain without having to go to a dentist. But if you need to go to the dentist, I'm going to show you a couple of things that we can do to sort out your wisdom tooth pain, and as a very last resort, actually taking the tooth out. So the first thing we need to understand is not everyone is going to have pain with their wisdom teeth. Most people, the wisdom teeth just come out and there's hardly any problem at all. But for those people who do get pain with their wisdom teeth, let's have a look at exactly what's going on so you can understand why you're getting pain, and then we can talk about how to fix it. So this is a picture of a wisdom tooth, and this is an x-ray of the same wisdom tooth. You can see that the teeth are not upright. They're not all in the same direction. Now, most of the time they are in the same direction, but this is when it starts causing issues, is when the tooth is leaning in a certain way, leaning into the tooth in front. And this is called an impacted wisdom tooth. And the problem really comes because the tooth can't come all the way up into your mouth. And if it's only a little way in, food and bacteria and stuff can get in between the two teeth and start causing decay, right? And this, before it causes decay in the tooth, it causes loads of gum inflammation just around this area here, and that is what really hurts because it swells up. The swelling on its own hurts, and then you start biting it with your top wisdom tooth, which again really hurts. So the first thing you can do is to get yourself a decent mouthwash, right? Not any old mouthwash, get something with chlorhexidine in it. And the one that I tend to recommend to my patients is Corsadil, right? It tastes horrible, and don't use it for long periods of time, but it's a really good antibacterial mouthwash which can really get you out of trouble. The way to use it as well is slightly different, not just like a mouthwash. I tend to recommend dipping your toothbrush into the mouthwash and then using your toothbrush to clean around this area, because it's probably really tender. You want to be gentle with it, but you want to get this antibacterial mouthwash right back there to really calm the area down, and then you can look at some kind of long-term solution. Okay, so if you've calmed the area down, or say worst case scenario it hasn't worked, you're probably going to go and need to see a dentist now. And there's a couple of things that we can do in situations like this, right? The first thing we've got to do is just calm the area down a little bit. So it may involve giving you some antibiotics, but make sure you come back to see the dentist after the area's calm and it's not hurting anymore. Because the next thing is actually just to cut the gum around the wisdom tooth, if this is possible. And it sounds horrible and it sounds painful, but it doesn't hurt, and it takes about 10 minutes to do. It's really quick and easy, and most people who we do this for have a dramatic improvement, right? And it's not just a short-term one, it's years and years. So, this could be a really good option for you. Okay, so let's say this hasn't worked, right? And you're still getting pain from your wisdom tooth and it's impacted into the tooth next door. Then we need to start looking at taking wisdom teeth out. Now, you've probably noticed I've been concentrating in this video all about lower wisdom teeth. And the reason for this is mainly the bottom ones which cause you problems, and there's the bottom ones which are more difficult to take out. So top ones hardly ever cause you problems, but if they need to come out, they're usually pretty easy. Taking out a bottom wisdom tooth is sometimes it's easy, sometimes it's not, right? So let's concentrate on the situations where it's not. I'd rather give you like a worst case scenario. The problem is, and you can see this on this x-ray, that there's no way that this tooth can just be lifted straight out. Because you've got the tooth in the way on one side, and then above the wisdom tooth you've got all this bone. So we need to first of all cut the gum a little bit, right, and then remove the bone, and then just maybe sometimes we need to cut the tooth and do all sorts of little things just to be able to lift this wisdom tooth out without causing any permanent damage. As you can imagine, this sounds horrible. It sounds like, oh my God, you're having the gum cut and all this bone removed and everything. And I'll be honest, it's not, healing wise, the first couple of days, it's usually a bit uncomfortable. But let's hear it. I did this a few days ago, and here's what my patient said about it.
I was really nervous and apprehensive before the actual appointment where I was to take my wisdom tooth out. But I think throughout the whole procedure, it was really not as stressful as I thought. Like, Dr. Goes made it really easy for me, and he comforted me and made sure that everything was going to be okay in the end. Yeah, so the recovery, I anticipated it to be a lot worse than what I expected, so that was a really good sign for me. It did take around 3 to 4 days for me to fully recover, so the swelling to go down, for the bleeding to stop. But yeah, I think I recovered quite quickly actually.